Today, we will start to look at professional identity in nursing by reviewing the first portion of the Nursing and Allied Health Handbook. This will also help you in completing one of your objectives for today, which is to be able to list the 5 C's. Let's begin with our mission statement. Nursing and Allied Health is composed of the Associate Degree Nursing, Vocational Nursing, Respiratory Care, and Emergency Medical Technician programs. Our mission is to facilitate an interprofessional learning environment which helps the students provide safe care and employs cultural responsiveness. A spirit of inquiry is embraced as we continue to ask why until we arrive at a solution. Our vision is to be a resource for health education and promotion for the Salinas Valley. We have community partners such as the local hospitals, and our list continues to grow. You will take part in a community project over your next 4 semesters in the program, where you will hopefully fulfill this vision. The program core values are also known as the 5 C's. These are comportment, competence, caring, collaboration, and curiosity. Notice how we reference spirit of inquiry from our mission statement as curiosity. In the next slide, we will talk about collaboration. Take a moment, and feel free to stop the video, to write down your initial thoughts, feelings, and definitions of each of the 5 C's. When you're ready, start the video again. You will be referring to these writings later. An interprofessional learning environment was also present in our mission. When working as a team, it is helpful to have met these core competencies. This semester, you will work to identify and begin to utilize them in your nursing practice. Can you relate these core competencies to any of the 5 C's? Values, ethics, and roles responsibilities are examples of comportment, while communication and teamwork are examples of collaboration. Some of the key points in our nursing and allied health philosophy include an evolving learning environment that promotes curiosity within a safe and ethical standard. Creation of an inclusive learning environment. We recognize that each of you possesses unique learning needs and life experiences, which will help you in problem solving and developing your clinical judgment. Facilitation of your learning. The responsibility for your learning rests with you. Tools will be provided to assist you in being successful. Someone once said, "The one who does the work does the learning," and this is true. Cohort building. You are now the class of 2022. There is no more competition, so work together toward a common goal, becoming a nurse. And viewing the person as a whole person in their environment and learning how to adapt care to meet their healthcare needs. Our core values, the 5 C's, in combination with the nursing process, assessment, diagnosis, planning, implementation, and evaluation, also known as ADPI, form our conceptual framework, which is the foundation for facilitating your learning. The framework goes from simple to complex and includes the continuum of health. Now, remember when I asked you to write down your personal definitions of the 5 C's? I would like you to refer to those as we talk about the end of program student learning outcomes, also known as the EOPSLOs. Think about how your definitions compare. And what does all this mean? It means that our core values are what we want you to possess when you graduate. I want to read these to you as they will guide you over the next 2 years. By the end of the Associate Degree Nursing program, the student will be able to incorporate leadership, management, and legal ethical principles to guide practice as a professional nurse. This is comportment. Apply increasingly complex clinical judgment and theoretical concepts when providing safe nursing care to diverse individuals across the lifespan in a variety of settings. This is competence. Integrate caring into relationships and nursing interventions that demonstrate sensitivity to the values of others. This is caring. Communicate and collaborate with members of the interprofessional healthcare team to coordinate care and optimize health outcomes. This is collaboration. Model a spirit of inquiry when examining data, challenging the status quo, questioning underlying assumptions, and offering new insights to improve quality of care. This is curiosity. Congratulations! You survived your first lecture in nursing school.